Welcome to the next segment of our series on the basics of team-based care. This program is brought to you by the Regional Chronic Disease Collaborative members of Alaska, Hawaii, Montana, and Wyoming. In this segment, we will discuss how to design a team-based care model that will best fit the goals of our patients, practice, and community. First, we will focus on establishing our goals and objectives for team-based care. Let's revisit some of the potential goals for team-based care we can use to help guide our own goals. Providing better access to care for our patients and improved patient experience. Improving support for patients with complex conditions and improved overall population health. We can focus on expanding our care team's capacity, knowledge, and resilience, and create a culture of quality, teamwork, and flexibility within our practice. The first step in designing a model to fit our needs is to define what we are trying to accomplish. How might a team-based care approach help us accomplish it? And how will we measure it? Which means defining performance measures to help ensure the changes we make have the effect we want. In the upcoming slides, we will provide some ideas, suggestions, and examples to help define our own goals and an approach that best fits our needs. Team-based care is not one specific thing or model. For example, it might be used to expand the services we are already offering or to assign different responsibilities to staff. It can be used to provide new care delivery services in our practice or to focus on a specific gap in care. We might also use it to focus on prevention services, addressing health-related social needs, or other whole-person care. Teams can be used to effectively perform these key primary care functions that might sometimes get missed or deprioritized under the stress of busy workloads, staffing changes, or shortages. When developing our goals for team-based care, there are some things to consider that may help provide direction, reduce burden, or help us gain efficiency. When possible, align with existing initiatives or requirements. This may be things like value-based payment models, quality program reporting, or community initiatives. Review data to identify specific needs, gaps in care, or improvement opportunities. Assess our existing staff composition, looking at both clinical staff and administrative staff. How might redistributing work make a difference? Take this opportunity to identify more efficient workflows and eliminate unnecessary activities and waste. And consider the return on investment for this work. ROI might be reducing staff workload, improving performance tied to value-based payment. It might affect the largest number of patients or the most in need, or it might be the easiest issue or service to start with. Considering the return on investment may help when designing our team-based care model. For a deeper dive on how we might design a team-based care model to fit our needs, we can use this Primary Care Team Guide website. We will reference resources and information from this website throughout this learning series. More information about this website is provided in the wrap-up and resources segment of this learning series. Within this website, we can access the Get Started section. Answering 5 questions will direct us to the best place to start. The Build the Team section provides detailed information on how we might use our team members and what their roles might be. There are assessments available to help us determine the current use of our staff in each learning module. And the Doing the Work section can provide information on what services or functions we might include in our team-based care model to help meet our goals. Under each function, we can assess our practice. Beginning with the full practice assessment can help determine where we might start on our team-based care journey. When choosing our goals for team-based care, we want to make sure to keep them manageable and achievable. We can always expand our goals to fit a larger vision of team-based care or do a phased approach. Many factors will determine where we start. At this point, we will choose what makes sense to start with, based on what we know now. This is just the first step in the planning process, and we may revise as we get more information and test out ideas. For more guidance on how to choose goals and performance measures, review the recommendations in the Quality Improvement Basics Learning Series. The link is available in the description below. This series covers in more detail how to choose goals and performance measures using the Institute for Healthcare Improvement's recommended model for improvement. To help prepare and support our transition to team-based care, take a minute to further define the value of the team-based care model we have designed by answering these questions. What is the value of this model to our practice or health systems and our team members? What is the value to our patients, partners, and stakeholders? And what is the value to our community? Taking time to think through these questions may help us further define our design and will pave the way for the communication we need to provide in later stages of this process. Next, it is helpful to define our future state. A future state is the desired outcome after a change initiative has been implemented. It outlines how processes, systems, and behaviors should ideally look once the change has been fully adopted. Think about how the new model would change things for our staff, the culture of our organization, the process and systems that are used to run the practice, like the EHR, standing orders, the billing system, or quality reporting, and structures like office space, exam rooms, and meeting spaces. We will also want to consider what will or should change for those external to the practice, especially our patients, our partners, external processes and systems, and our stakeholders. Keeping all of these factors in mind as we define our future state will help us identify the gap between our current state and where we want to be. To perform a gap analysis between the current way we are delivering care to our future state, make a list of the current services being provided that will be affected by the change, the workflows, processes, and assignments. Map them to the future services or what we are hoping to provide under team-based care. Think about what is currently working well and make sure to include those in the future state. Also identify what is not currently working well and find ways to change or improve them in our future state. Then identify the gaps between the current and future states. This is just the first draft to provide an outline of a plan. This exercise will help as we work on the next step, which is establishing the team. Team-based care models take many forms. Whether formal or informal, big or small, we should start with where we are and expect our plan to change as we learn and test out ideas. Even small changes can provide team-based care services that can benefit our patients, practice, and community. These are our calls to action for this segment. Define goals and performance measures for a team-based care approach that fits our practice. Assess our practice and team to help design our team-based care model. You can find a link to a practice assessment tool in the description below. And define the future state we hope to achieve, what to keep, what to change, and what gaps exist. In the next segment, we will review things to consider when establishing our care team members and defining their roles and responsibilities. Thank you for joining us.